Hi, Ankur. Good to be here with you today.
Hello, Dr. Mark. Same here. Feelings mutual.
Wonderful. So tell me about social participation, meaningful engagement. Why is that important? How you see that happening in India?
So, social participant is very important, I believe. And India, there is a lot of work going on in social participation because, see, it's very simple when we talk about a logic that in democracy, you have a representative. You do not talk about people without listening to the people. It's the same thing that happens in any world, and especially in the NCD and the diabetes world. That if you want to make reservations, if you want to make policies, you have to ask people who are actually living with it, because we bring an insight that nobody else brings it. And in India especially, we are very fond of hacks. So people have tried and tested hacks that might work with the government or the policymakers to make it more easy, more interesting. So I think that is why the social impact is very important when it comes to NCDs.
Yeah. Well, I agree with you. I usually say that if people are not involved in the decisions, you run the risk of, spending all the resources in something that is not what is truly needed. So it makes no sense. And we have been fighting for that in Brazil, but also abroad. And we are happy to see a paragraph in the political declaration now that will be a commitment between nations about it. We know that we have been fighting to be so more active verbs. It is recognize what is there, but anyway, it is there. And I think now we need to fight to make sure that the nations, they truly implement it, and not as something eventual, but as part of the structure of the health system. I think that will make a huge change, having the people participating effectively in all decisions that will impact them.
I mean, yeah, I mean, I'm very thankful about this NCD political declaration that's coming out, and as rightly said, that recognition is a very different thing, and hearing our voice, hearing what we want to say is a very different thing. We have been called in a lot of conferences, but there we are just participants. We are not the decision makers. We want to be the decision makers, and hopefully, with this NCD declaration coming in, I think we have a very bright future when it comes to community participation.
Yeah. Yes, I totally agree. I think most of the times we see us participating in a tokenistic manner. So not truly participating in the decisions, but being invited just to agree with what was already decided.
Correct.
Or in a number, of people that would never be able to change the decision that was made. And I think it's something important to consider that, if you are impacted by what is decided, how come you are not participating to that decision?
100%. I mean, you see someone from India who is living with type 1 diabetes, and then then the policymakers are making changes in how to use a pump, suppose, just giving an example, and most of the people in India does not use a pump, then it does not make sense. And India being a very huge country, there is a lot of disparity in India, and but the healthcare system is such robust. So it is really required for people to recognize the actual needs, and as you said, that they might spend the resources where it is not needed.
Yeah.
And the voices bring that inside, that you have to spend resources at not a place where it is not needed, but on a place where it actually matters and most of the masses use. That's the main point of getting all these resources, right? It is for the people. So these meaningful conversations might have to be from the people who actually live with it, and it has to be very diverse also. What I believe, that you cannot have a certain section of people come and talk about lived experience. It has to be from so just to give you an example, India is a very vast country, as I said. So someone from maybe north or south will have very different insight on type 1 diabetes. So you have to bring it's not possible to bring everyone, but as someone from every region is something that is very possible. So I think this is one thing that should be implemented when we are talking about meaningful conversation. That's how the meaningful conversation can happen.
No, I totally agree with you. I think we need to empower the communities, we empower the leaders, because the leaders cannot just bring their experience when they come to a decision table. They need to bring the experience of the community, so what will benefit their community. So this is what we call people-centered care, because otherwise, if it's just will benefit one person and not the others, it will be too limited and maybe even a mistake.
Yeah, it is. It is. And also that something that I want to ask you actually was the data. What do you think about the data that has been so in India there is no data about type 1 diabetes, unfortunately. And I think that the social inclusion and the community inclusion might help getting that data, because suppose in some state there might be a different kind of people living with type 1 diabetes, in some state the demographic might be different. So what do you think about that?
I think data is key in order to make the decisions, the political decisions, because how can you decide if you don't know how many people, how people are, what, if they are achieving the targets or not. I think this is very challenging. And we have been having the experience in Brazil and in different countries, that when some data arrives, so this kind of even shock the community and the decision makers, because they don't expect to see that data, because without data you keep making decisions that seem to be the right ones. When you see the data, correct, then you need to react appropriately.
So, Rama, is there something that you would like to say? We are at the Younger Week, and it's been such a great week. There is a lot of talk about NCDs. There is a lot of talk about diabetes. So, is there something that you want to share with your government, or even the different governments from in the world, about how we want to approach the problem of this NCD?
Mm-hmm. Yeah, well, I think so. I think so. For me, we have been fighting with the draft of the political declaration from the beginning. There in May, we have been trying to contribute for the development of the final political declaration. Some things were incorporated that we wanted to be, some things were not, and we are concerned. In terms of diabetes, we are still very concerned, because the Global Diabetes Compact targets were not incorporated, and in our view, this was a mistake. Actually, type 1 diabetes was not mentioned, and type 1 diabetes is something important to be in the declaration, but it's unfortunately not. But other things were incorporated, fortunately. But the thing is, the declaration is not enough. The declaration needs to be taken into account now for implementation, and also what was left out should be thought and should be now also included as a goal for the different governments. Please, if you could also share your view on that.
I 100% agree with you. Now that the declaration is in place, it's a start, but it's still a long way to go, I believe. And implementation, and more than implementation, I think the accountability is an issue. Once that, if we can solve that, and of course, as you said, that it is something that is being developed, and it will be developed more and more. And you're right, there must be inclusion. There should be diabetes type 1 should be included, and other things will be included. But to start, it is somewhere we can start now. But again, the accountability comes in the factor as well, because there are a lot of declarations in the world, but the accountability and how it reaches the grassroots levels, how it reaches Brazil, how it reaches India, to the rural areas, to the places where they don't know what NCD Alliance is, but it should. And that's what I want to say to all the governments in the world, that do not take this lightly. Do not take this because we are a small fragment in the whole population, but we are still a fragment in the whole population.
Mm-hmm. Yeah, I agree with you. Yeah, wonderful.
Thank you. Thank you so much.
Thank you.